Good morning, good afternoon, wherever you are. Thank you, Pharma Logistic Africa, for inviting Africa CDC to share our experience supply chain management during this COVID-19 pandemic. My name is Merawi Aragaw, Head for Emergency Preparedness Response Division in Africa CDC. My presentation is just brief to provoke your thoughts and discussion. I will walk you through what Africa CDC has done in response to this COVID-19 pandemic, the challenges and experiences we faced in supply chain specifically during this pandemic, and the response of Africa CDC in response to these supply chain challenges and lessons learned moving forward. Africa CDC provides support to member states in different ways. We can categorize them mainly into 4 areas. The first one is policy, advocacy, strategy, and coordination by developing continental response strategy and so on. The second one is developing and disseminating guidance documents. These are technical documents, including infection prevention and control guidance, laboratory diagnostic guidance, case management guidance, and so on. The third is by technical support through training, research, and deployment of technical expertise to member states. The fourth one is procurement and distribution of emergency response supplies. Supply chain is a critical part in our support in this pandemic, and Africa CDC has been doing this through its regional collaborating centers in 5 regional in 5 Africa Union regions. Africa CDC has faced challenges what the globe has already faced, and specifically, just this is to present you the global challenges and implemented solutions during this pandemic. Like there was a global demand. Every country wanted to secure supplies for themselves. And this has led really a global shortage of supplies and disaggregated supplies, supply chain leading to bottlenecks, disruption of workforce capacity and logistics. And quality was also another issue, with new entrants into the supplier market have some quality issues also raised. The other main challenge was low or no international cooperation and coordination during this pandemic. What were implemented globally were diplomacy of supplies. Some countries created bilateral relations and agreements. Some countries also restrict export so that they can fill their demands. Then repurposing of manufacturers, and the other is emergency use authorization of supplies, including vaccine now, and also diagnostics and therapeutics. And there are different local, regional solutions. So Africa CDC has specifically faced different challenges, specifically with sourcing of supplies. Where can we get these items? And price negotiation. This was another challenge. And payment arrangement and logistics. These were challenges. Technically, quantification of the needs of supplies across the continent was another challenge. Because this is a new disease, no one knows how it is transmitted, how fast it is going to affect us, and so on. So this has really created challenges in quantification of the needs and demands of the continent. Accuracy of early models was also another challenge for quantification. Low testing rates and low data access and timely sharing, and limited data on supply and demand. All these really challenge our quantification as a continental demand. The other challenge is procurement. And the procurement, there is limited production in Africa and on supplies. including diagnostics, and there is financial constraints, low market intelligence and analysis, competitive market, unprecedented supply disruption, minimum order quantities and the requirement for advance payment. All these were challenges. The other challenge is logistics. You remember lockdown everywhere. That is another challenge, in movement restriction, limited humanitarian corridors, low level of preparedness and stockpiling. These were main challenges that Africa and the African Union and African Union member states have faced. So in response to this pandemic, and specifically in response to the challenges supply chain, Africa CDC has developed and responded in different ways. Just this is the highlights of the main strategies that we put in place in response to this challenge. First, we established the Africa Task Force for Coronavirus Response and different initiatives, like Supply Chain Technical Working Group were established, and that has been still working, and a PACT initiative for enhancing testing across the continent was also launched. The other mechanism that we put in place was interdepartmental coordination within the African Union Commission. We use the deployment of experts using military flights from Peace and Security Department of the African Union Commission. We also get the opportunity to use the continental logistic base, military continental logistic base in Douala in support of this response. The other strategy that we put in place was activation of emergency procurement policy. This is for the first time that African Union has activated. So this has to fast track the procurement process. The other is strong partnership. We created a really strong partnership with WFP, Ethiopian Airlines, UNICEF, and so on. We signed agreements with WFP, service level agreements with UNICEF, MOUs, and Ethiopian Airlines. We take advantage of the Ethiopian Airlines cold chain and facility to move cold chain sensitive items and supplies like diagnostics across the continent in a timely manner. The other response strategy that we put in place was the Africa Medical Supply Platform, which is a digital platform for centralized and pool procurement to address all the challenges in supply chain. This is an initiative launched by His Excellency President of South Africa, the current chair of the African Union, in response to this pandemic to address the supply chain, the supply need of the continent. What is the need with Africa Medical Supply Platform? What is the value addition? The value addition is it has global manufacturer base, the volume aggregation, quota management, payment facilitation, and logistics support. And the procedures are pretty simple. Critical medical supplies are sourced, buyers place orders in the platform, buyers make payments, sellers prepare shipment, delivery to the countries. So in this process, Afrexim Bank is facilitating payment, and freight forwarders, different freight forwarders are partners in this platform. Overall, 55 countries of African Union member states are now onboarded, and Africa CDC placed order of around 20 million equivalent laboratory reagents and critical care medical equipments through this medical supply platform. So finally, what are the lessons learned in this pandemic response, specifically in supply chain? First is enhancing supply chain preparedness. We really need to enhance our supply chain preparedness by putting systems and structures in place, including like policy plans, procedures for public health emergency supply chain management, framework agreements, service level agreements, and so on. We need also to prepare the necessary infrastructure and agreements to stockpile critical supplies that are not available in Africa. The second lesson learned is adapting pool procurement. This is to utilizing pool procurement method for future public health emergencies so that we can get advantage of negotiated price and aggregated quota management. The other lesson learned is we need to support local manufacturing in Africa. We need to boost local manufacturing within the free trade agreement. We need also to set a quality framework for African manufacturers so that they can get a global market. Finally, we need to mobilize resources. We need to have that mechanism for emergency preparedness response support. This is, in a nutshell, my presentation, what we have been through, and I'm happy to respond to any comment, question you have, and thank you for listening. Thank you very much.